Dialysis is cleaning of blood when your kidneys are not working that well. So if we want a filter to clean the blood, we need the blood going to filter and coming back to our body. It is more challenging than you'd think it would be, because we need about half a liter of blood going to a filter and coming back in a minute, and that keeps on going for a while. So even after dialysis was discovered, invented, it took many years to figure out a way that we can get that done consistently without causing major problems. So they came up with a great idea. If you look at your arm, your natural veins are small and weak, and they can't handle that kind of fast blood flow. If you connect that vein to an artery, it gives the vein a workout. So it takes a few months, but the vein becomes bigger and stronger. And then it can handle that kind of blood flow. And this is what we call a dialysis fistula. What happens if you don't have good veins? That's a common question we get. And in that case, we can use a graft. That's like an artificial vein that can go in your arm and work just like a vein. When you look from outside, you can hardly notice a difference whether it's a fistula or a graft. They both stay inside the arm. If you have seen pictures of those big bodybuilders, the veins look pretty much like that, puffed up big veins, or a graft would look something like that. Those two are our main dialysis access options. That's the way we can get a lot of blood to the filter, return back without having significant problems or complications. The third option is a catheter, which is this tube. And that's something we use if you can't get a fistula or a graft, because usually both of them need some time before we can use them. So if you need sudden dialysis, or you never had a fistula or graft put in before you needed dialysis, then we have to put this tube. This goes like a big IV in your neck most of the time, and it's coming out somewhere around here in the chest. This is a decent way to get dialysis done on short notice, but it's not a good dialysis option, access option for long term. The other option is for peritoneal dialysis. They need a catheter just like this catheter. Instead of going in the vein, it ends up going in your abdomen, but has much less risk of infection than the catheter going in vein does. For hemodialysis, the best access is AV fistula. So if you have good natural vein and we can get it developed to a good size, that's the best option you have, because that has least risk of infection, that requires least care going forward, has less chance of clotting and giving problems on a day-to-day basis. If you don't have a good natural vein and ended up with a graft, that may have slightly higher risk of infection and clotting, but it is still much better than having a catheter, which is least preferred option. Going back to when we needed a fistula, our veins naturally are small and weak, and they were not meant to flow that fast and work for dialysis. We artificially modified them to help us get the dialysis done. They can do it, but parts of veins don't develop as good as we would want them to, and may have stenosis, scar tissue, clogging, and if that comes in, then fistula can stop working. Early signs are if it starts bleeding longer, or they are noticing lower blood flows in the fistula. In that case, we can go in the fistula, put an IV in, inject some contrast, and it gives us some pictures to get an idea where the narrowing is coming at. If we see that, we can go through the same IV with a balloon and open that area up so that it can continue working well for us. It's not a surgery. You'd be surprised, it's a relatively fast, quick procedure, mostly done as an outpatient, and has pretty low complication rate.